Good morning. I'm going to talk about medical practitioners number one. Practioners. In Britain, doctors, also known as medical practitioners, must be qualified, have a university degree in medicine. They must also be registered, include the General Medical Council list or register, in order to practice. A doctor who treats patients as opposed to one who only does research. He is called a clinician. A doctor who provides primary care for patients is known as general practitioner or GP, or family doctor. GP usually work in a group practice. Large group practice work in a building called health care. Note, in British English, the verb is spelled practice and the noun is spelled practice. Specialties. Specialist doctor, for example, pediatrician, generally work in hospitals. However, those who work outside the NHS providing private health care may have consulting rooms outside a hospital, for example, in the famous Harley Street in London. The two main branches of medicine are surgery and internal medicine, and the doctors who practice these branches are called surgeons and physicians, respectively. In Britain, male surgeons are addressed as Mr. and females as Miss. So, Dr. Smith is a physician and Mrs. Smith is a surgeon. A cardiologist specializes in disease of the heart and circulation of cardiology. A geriatrician is a specialist in disease of elderly patient or geriatrics. An anesthetist is a specialist in anesthetic. Note, names of specialties usually end in ology. Names of specialists usually ends in ologies. If the name of a specialty ends in ICS, the name of the specialist ends in ECM. There's some exception. For example, anesthetic and anesthetist. Choosing a specialty. Jill Matthews has just graduated from medical school and is talking about her future. I haven't decided what to specialize in yet. I need more experience before I decide, but I'm quite attracted to the idea of pediatrics because I like working with children. I certainly prefer to work with children than, say, elderly patients. So I don't fancy geriatrics. I was never very interested in detailed anatomy, so the surgical specialties like neurosurgery don't really appeal. You have to be good with your hands, which I don't think is a problem for me. I've assisted at operations several times, and I've even done some minor OPS by myself. But surgeons have to be able to do the same thing again without getting bored, like tying off cut arteries and so on. I don't think that will be a problem for me, but they need to make decisions fast, and I'm not too good at that. I like to have time to think, which means surgery probably not right for me. Note, the collocation good with is followed by a noun. He's good with children. The collocation good at is followed by the ing form of a verb, or by a noun. She is good at explaining procedure, and she's good at explanation. Thank you. Exercise 5.1. Write the sentence to describe the work of the specialist in each branch of medicine. Look at B opposite to help you. Number 1, dermatology. A dermatologist specializes in disease of the skin. Rheumatology. A rheumatologist specializes in disease of the bones. Traumatology. A traumatologist specializes in disease of accidents. Pediatrics. A pediatrician specializes in disease of children. Obstetrics. An obstetrician specializes in disease of newborn. 5.2. Complete the table with works from A, B, and C opposite unrelated form. Put a stress mark in front of the stressed syllable in each word. The first one has been done for you. Verb, specialized. Noun, specialist. Known or activity or thing, specialty. Practice, practioner, practice. Consult, consulter, consultation. Assist, assistance, assistant, assistance. Graduate, graduate, graduation. Qualify, qualification. 5.3. Find preposition in C opposite that can be used to make words combination with the word in the box. Then use the correct form of the words to complete the sentences. A pathologist specializes in diagnosing disease through examining cells in tissue. A pediatrician must enjoy working with children. An oncologist is interested in the diagnosis and treatment of cancer. A psychiatrist must be good of the counseling. A neurosurgeon must be good with the hands. 5.4. Make word combination using a word from each box. 2 words can be used twice. Look at A, B, and C opposite to help you. Consulting rooms, general practitioner, group practice, health center, internal medicine, and surgical specialties. Thank you, that's it. Ejercicios. El ejercicio 5.1. Escribe oraciones que describan el trabajo de la especialidad. Dermatología. Un dermatólogo se especializa en las enfermedades de la piel. El reumatólogo se especializa en las enfermedades de los huesos. El traumatólogo se especializa en los accidentes, en las enfermedades de los accidentes. El pediatra se especializa en las enfermedades de los niños y el obstetra se especializa en los nuevos nacidos. El punto 5.2. Completa la tabla con las palabras de A, B y C y pon una marca enfrente de la sílaba de cada palabra. Especialista, especialidad. Practioner, práctica. Consulta, consultador. Asistente, asistencia. Graduado, graduación. Calificado, calificación. El punto 5.3. Encuentra las preposiciones en la oposición C que pueden ser usadas para crear combinaciones para llenar los espacios en blanco. Un patólogo se especializa en el diagnóstico de las enfermedades examinando células y tejidos. Un pediatra disfruta mucho trabajando con niños. El oncólogo está interesado en el diagnóstico y el tratamiento del cáncer. El psiquiatra debe ser bueno en las consultas. El neurocirujano debe ser bueno con las manos. 5.4. Haz combinaciones utilizando las palabras de cada caja. Consulting rooms. Cuartos de consulta. General practitioner. Practicador general. Grupos de práctica. Centro de salud. Medicina interna. Y cirugías especializadas. Es todo, gracias.